of Honorable Peter Abiola Makinde representing Ondo East West Federal Constituency is to put smile in the faces of people he represented at the National Assembly. Wednesday 9th of March 2022 was remarkable as the people of Ondo State will not forget in a hurry. The traditional rulers, clergymen, and medical professionals journeying from Ondo State to the National Assembly to witness and also contribute to the proposal for the establishment of Federal University of Medical and Health Sciences in Ondo Town, sponsored by Honorable Peter Abiola Makinde.
Bono. Of course, my name is Honorable Abiola Peter Makinde. I represent the good people of Ondo East and West Federal Constituency, and I'm the sponsor of this bill, the Federal University of Medical and Health Sciences, Ondo State. I wholeheartedly welcome all participants and stakeholders to this special event. Before this committee is a bill for an act to establish the Federal University of Medical and Health Sciences, Ondo State. This bill has been read and passed first reading, second reading at the Hallowed Chamber. Mr. Chairman, honorable members, this is a straightforward bill that seeks to establish a specialized University of Medical and Health Sciences in Ondo State. The desire to create the University of Medical and Health Sciences in Ondo State through legislation of the National Assembly stemmed from the need to provide for more opportunities and level playground for all to gain admission into Nigerian universities to specialize in medicine and medicine-related disciplines. However, and most importantly, is to address the medical workforce shortage we are experiencing when compared to our increasing population of over 200 million. This shortage has created unevenness in the state, region, and country at large. The future demand for more medical graduates and for extensive medical research. Mr. Chairman, this bill is organized into 28 clauses. Of course, it has the establishment section of it, and this is an institution with perpetual succession that can sue and be sued. And there are other sections in the bill which has been examined in the Hallowed Chamber. Mr. Chairman, respected colleagues, establishing a Federal University of Medical and Health Sciences in Ondo will contribute to the health, cultural, social, economic well-being of the people of Ondo State, its region, and of course, the country at large, through advanced patient-centered care and improved individual and public health outcomes. I therefore urge this committee to give this bill necessary endorsement it needs so that Nigerians can enjoy adequate medical workforce it needs to stabilize our health and wellness. Health is wealth. Adequate medical workforce will result in quality healthcare services across the nation. Thank you, Mr. Chairman and honorable members.
According to High Chief Sir Simeon Olushola Oguntimehin, OON Lisa of Ondo Kingdom, while speaking to Dajik TV News, describes Honorable Peter Abiola Makinde as a blessing to the people of Ondo State. Various speakers, however, says the establishment of the university will go a long way in addressing shortage of health institutions in the state, region, and the country at large. The establishment of the Federal University of Medical and Health Sciences in Ondo State no doubt will contribute to the health, cultural, and social well-being of the people of Ondo State. Honorable Peter Abiola Makinde expresses his joy in making the day a reality. According to him, specialized medical universities have become very important in Nigeria.
Well, the public hearing, we had massive support of the people towards the establishment of Federal University of Medical and Health Sciences in Ondo State. And it has been proven amongst the people. That's the purpose of the public hearing, so that people can come around and say one or two things that they know. And just like what we have heard today, we learned that there are shortages, especially within the medical workforce. There has been exodus of medical workforce leaving the country. And of course, look at what is happening in Ukraine now. If we have enough universities, our children will not be going out of the country to study medicine. So we have a population of about 200 million. Meanwhile, we only have 70,000 graduates in medicine. So how can 70,000 take care of over 200 million? That would be like a ratio of 1 to 3,000. So that means one doctor to 3,000 people. So you can imagine.
Because of increasing demand for medical and health professionals in Nigeria. He further highlighted the importance of the bill and the demand from the people of his constituency of their desire to have Federal University of Medical and Health Sciences.
The reason why we have a Federal University of Medical and Health Sciences is to be able to train new medical doctors, new medical practitioners into that field of medical workforce. So, and that's why I sponsored that bill, because we saw a need and we have to meet the need for a better tomorrow. Absolutely. The bill had passed the first reading in the Hollow Chamber, passed the second reading in the Hollow Chamber, and of course passed the public hearing. So it's a straightforward bill. It's a bill that is meeting the need of the people, which of course we know that health is wealth, and we have to ensure that that is taken care of.
From the National Assembly in Abuja, Comfort Olayinka reporting.